Obesity in East San Jose is an epidemic. We have Hispanics, we have Vietnamese, and we have multicultural community with obesity. Obesity is #1 problem in this community, associated to diabetes, hypertension, and cholesterol. All this brings cardiovascular morbidity and mortality. So the problem with obesity is that it could be prevented, and it can be the major contribution for all hypertension and diabetes. If we control obesity, we are going to control all these medical problems. It's the best practice to prevent obesity. We've been thinking about starting the program for many years because there is a big need in the community for obesity. We want something that is scientific, and I have the training going to multiple conferences for cardiometabolic disease and for obesity, and I think I'm ready to start the program after many years of thinking about that, and I think that we are going to help the community starting the program. Treating obesity, we can reduce a lot of medications, not only for hypertension, but for diabetes, for cholesterol. If we lose 10 to 15% of the body weight, we can stop taking probably 1-2 medications for hypertension, and the same for diabetes. So this is very important to bring the weight down 15-20%, and this is going to reverse the metabolic disorder, the diabetes and the hypertension and cholesterol. The diet we're going to implement in this program is based on low carb, low fat, with a healthy fat, and also with a protein diet. So it's going to be low carb, healthy fats, and some protein in the diet. That's the basis for the composition, and we're going to reduce the amount of calories depending on the patient's weight and patient's BMI. We can put the patient on 800 calories versus 1,000 or 1,200 calories. What I see in my practice is a range of ages with morbid obesity, with extremely obese children already at age 8, 10, 12, and they have already pre-diabetes. Their parents are also obese, and the kids are learning from their parents to eat, and they go out and they eat what their parents order, right? So if the family is eating pizza, everybody's eating pizza. So we need to teach our patients, our community, what to eat, because what I see is diabetes that it could be prevented if we prevent obesity. Starting from a good diet, a good exercise program, we can stop this epidemic of diabetes and cardiovascular disease. California Medical Weight Management is an organization that is scientific. They use good nutrition, they use follow-ups to coach the patients, and they use medications to help the patient to keep with the weight loss and to keep with their diet. I recommend California Medical Weight Management because they have the experience and they have a program that is being established that proves that the patients can lose weight.